2 years ago, the world watched as a rapidly spreading virus, now known as COVID-19, was identified in Wuhan, China. Within a matter of days, everything would change in the United States. On March 19, 2020, Cameron County would receive notice of its first case, causing local leaders to find ways to navigate this new disease. On this segment of A Look Back, Cameron County Public Health is joined by Dr. James Castillo as he examines how the past 2 years have reshaped our lives.
Yeah, so I think the first experience was in December into January when you just started hearing news coming out of China about this new virus and, everybody wondering what's going to happen with it. Because this is not the first version of this type of virus to come around. There's been SARS-1 and then MERS. And so it never came home. It never came here. But there's been a playbook for it. The thought of how you're going to manage something like this. And so really this started December, January about a lot of learning, a lot of reading, keeping up with the science, hearing what the federal government was planning for. Because in the past, we've always been able to go to the CDC, right? The CDC, a world leader, they got all the experts. Let's hear what they're recommending and process the information. But then this time around, it was a bit different. We had dealt with another disease, a new disease before, with Zika down here. A lot of other places in the country didn't deal with it, but we did. And then it's really started in March, right, coming true about what we were dealing with. And still that big unknown, how bad of a disease is this? How deadly is it? The previous versions of it were extremely deadly. And then it turned out that this one was right in the sweet spot. It had just the right balance of infectiousness and lethality and asymptomatic transmission. It's like the perfect storm for widespread. But I think it was just unpredictable about how much disruption it would cause in everybody's daily life and family life and, the uncertainty about the future. Of all of the healthcare infrastructure that truly got overwhelmed, it was really the danger of our whole hospital system collapsing. But seeing the effects of an overwhelming number of patients on the hospitals and how that trickled down to every other illness that we treat, suddenly you're questioning whether you'll be there to treat a heart attack or a stroke or cancer. That was something that we had never experienced before. That I didn't really appreciate until that time about how fragile the system is. The concern I had was I have two parts of my practice. One part is I'm the health authority. The other part is I'm a practicing physician.
Right.
And my main specialty is palliative care. And so, at the same time I'm doing the public health side, I'm, taking care of patients and doing what I do there and worrying, am I going to catch this and bring it home to my family? I think my daughter would be okay, but what if my spouse gets it? And it's hard to keep it in perspective. Right? That the odds are that everything would be okay.
Yeah.
But you always wonder about what if not. I think at the very beginning, a lot of healthcare professionals were even isolating themselves from their family. And that was really, really difficult. And maybe, in hindsight, you would say, you shouldn't have done that. Hindsight's 20/20. But I think when you could start spending more time with your family, that was helpful. But then as the changes in our family life or our society kept going on and on and on, I think that's where it just got harder and harder for most people, right? So a lot of it was just about trying to evolve with the new data. Trying to get back to those things that we like to do as soon as you can. And that definitely helped try to cope with trying to recover from that shock to the disruption in the daily life. I think, as we start getting back to a true normal rather than a new normal, right? I think we'll get there, where, we don't have to keep worrying about this illness. We're not quite there yet, but it's coming. Being able to, give the time to heal from all of the disruptions in our lives, that will happen. We've been through wars and, other illnesses and other, major disasters. Nothing is prolonged, right? And nothing quite like this, but, people can recover from all these things. It does take time. That's the way human beings have always been. And we should be able to do that. But it'll take a lot of time and effort, and hopefully we learn new ways to help insulate ourselves from future disruptions like this. And people will get better.